Hi everybody, my name's Olga Ilic. I'm a GP from the Shepparton Women's Health Centre. Welcome to my presentation. Today I'll be speaking about intrauterine devices or IUDs. So a good place to start is, what is an IUD? So an IUD, as the name suggests, is a small device that sits in the uterus to prevent pregnancy. In this diagram of the female reproductive system, we have the ovaries, the fallopian tubes, the uterus, cervix, and vagina. And here within the uterus is an IUD. This IUD is T-shaped, and many are, but they don't have to be. At the base of the IUD is a string, and this string passes through the cervix and hangs high up in the vagina. I put this picture in to show how big an IUD is. As we said before, they vary in how they look, but most are this T-shaped, and most are around 3 centimetres in length and 3 centimetres in width. So why should someone consider an IUD? They are one of the most effective contraceptive options there is. They are effective for up to 5 to 10 years, depending on the type of IUD you choose. They are easy. Once they are inserted, there is nothing to remember on a day-to-day basis. Once your IUD is removed, your fertility is restored really quickly. And lastly, price-wise, there is a cost initially, but there's no ongoing cost. So compared to other methods, it's absolutely competitively priced. So now let's talk about the types of IUDs that are available. There are hormonal IUDs and copper IUDs available in Australia. And within both of these types, there are different sorts of hormonal and different sorts of copper IUDs available. Both hormonal and copper IUDs are made of flexible plastic, but as their name suggests, they are either coated in hormones or in copper. The hormonal IUDs are coated in the hormone progesterone. So let's spend some time talking about hormonal IUDs. As we said before, there are 2 different types of hormonal IUDs available in Australia. There is a smaller and a larger hormonal IUD. The smaller hormonal IUD releases a smaller amount of daily progesterone compared to the larger IUD. Both of these hormonal IUDs have a duration of 5 years. One great thing about hormonal IUDs is that the delivery of progesterone hormone to the uterine lining helps to keep the uterine lining thin, so that many users of these IUDs have lighter, less painful periods. And this is especially true of the larger hormonal IUD. For so many women, these lighter, less heavy periods, especially that the larger hormonal IUD can bring, can be life-changing. Now let's spend a quick moment talking about copper IUDs. These are less often used in Australia, but are important to mention. For some women, the fact that they have no hormones is a huge selling feature. Depending on the type of copper IUD that you choose, they can last either 5 to 10 years. One thing that must be known about copper IUDs is that some users can end up with heavier periods. So this does need to be taken into account if you are choosing a copper IUD. So let's talk quickly about how an IUD is inserted. Firstly, it is inserted by a trained gynecologist or a GP and involves a small procedure. The IUD comes in a big box, and the IUD sits in an inserter, and this is introduced into the vagina and placed through the cervix into the uterus. Once the inserter is into the uterus, the IUD is fitted and the inserter is removed and the strings are cut. Most women cope really well with having the insertion done while they're awake in the rooms. Alternatively, admission to hospital for the insertion under a light anaesthetic can be organised with a gynaecologist. I've listed 2 important complications on this page that need to be taken into account before having an IUD inserted. Firstly, infection. If there is an infection in the vagina, when the IUD is inserted, the infection can be introduced into the upper genital tract. So it is important to be screened for sexually transmitted infections before an IUD is inserted. Secondly, uterus perforation. This can occur if the IUD, when it's inserted, penetrates or perforates the uterine wall. This is incredibly rare, but is an important complication to be aware of. So what does one expect after having an IUD inserted? Some women can feel faint after having an IUD inserted, and this usually doesn't last very long. Cramping in the lower abdomen and back can also occur, and this can last for a few hours, even up to a few days. After the insertion, periods and bleeding can be irregular, most likely for the first 3 to 6 months, and often after this time, it will settle down. Infrequently, the IUD can fall out, and this is especially true in the first 3 months. Because of this, women are told that they can feel for the string after their period to ensure that it hasn't fallen out. It's important to know that IUDs do not protect against sexually transmitted infections, and for this reason, condoms are still recommended. And lastly, hormonal IUDs can give hormonal side effects, but these are not that common. Let's quickly mention how an IUD is removed. So as we said, high up in the vagina, there is a string. And when a trained gynecologist or GP removes an IUD, this string is pulled and the IUD is released. The IUD, as we said, is made of flexible plastic, so the IUD arms will bend and the IUD will often be removed easily and quite quickly for the woman. Most women, once again, cope very well with this procedure. Who should consider having an IUD? Any woman needing contraception can consider an IUD. Any age, doesn't matter what your age. Whether or not you've had children, you can consider having an IUD. Just to remind you, hormonal IUDs are especially good if you have heavy periods, if you have iron deficiency, and for endometriosis. And lastly, once again, just to let you know, hormonal IUDs can be used as part of menopausal hormone therapy. To find out if an IUD is suitable for your circumstances, please discuss this further with your doctor. Many thanks for listening to my presentation today.